guys. Happy Sunday. Happy Sunday. I wanted to go live just for a few moments. I want to address something and then I'm going to see if you guys have any questions. Hold on one second. Let's see. Okay. So first of all, as you guys come in, you guys know the routine. Let me know where you're watching from, your city and state. Let me know if you are in school. Are you a brand new MA? Have you been in, the field for a while already? And feel free to chime in on the topic below. But one of the things that I wanted to talk about is what medical assistants actually do, because some of the comments I've gotten, I see that they're kind of some of the things that people are referring to are things that maybe a CNA does or a nurse does. And so I wanted to talk about here what a medical assistant actually do. And feel free to let me know, if you have any other questions about the duties of a medical assistant in the chat, let me know. And then if you want to chime in as well. But first of all, as a medical assistant, you may have clinical tasks. Well, you will have clinical tasks, and then you may have some administrative tasks as well. So those clinical tasks include taking vital signs. So you guys know vital signs are blood pressure, pulse, respiration. You may be measuring height and weight. Most likely you will be. I shouldn't have said may. You will be measuring height and weight. And also rooming patients. So I always say, think about the person that brings you to the back when you are at the doctor's office yourself. That person that calls you to the back, gets you ready for the doctor, and assisting the provider. So that brings me to another thing that medical assistants do, another clinical task that medical assistants have, and that's assisting the provider. Our job is to make the provider's job easier, getting the patient ready, maybe assisting with certain procedures that the provider may have to perform. Injection. So depending on your state and the office policy as a medical assistant, another clinical duty you have is giving injections. Okay. Also EKG. So you may be doing EKGs, also collecting specimens. Now those specimens will include urine specimens, right? Depending on where you work, maybe even fecal specimens, right? And then also blood specimens. So you may work in a lab where you are drawing blood. So I'm also preparing the exam rooms for certain procedures, getting the exam room ready for the doctor. These are some of the clinical duties. And of course, there are more: eye exams, hearing exams, strep tests, COVID testing, flu testing. Feel free to add any other task in the chat that I haven't already mentioned. And before I get into the administrative tasks, let me see some of these comments here. So, okay. Hey, Five Moran. Hey, guys. Congratulations to those of you that passed your test. I see R&B. Okay, R&B has been chiming in every day. So happy to hear you pass your test. Congratulations. Irene from Virginia passed my CCMA. Congratulations. Is that the Queria? R&B is watching from Kansas City. BKNY Charlie watching from Georgia, starting MA classes next week. Okay, you're here early. Glad to have you here early. The Queer is watching from Albany, New York. Fab Moran says, I've always had bad experiences with MAs. Unfortunately, some people do. And this is all the more reason for you guys, when you do get into the field, to be the opposite. I always say, think about the medical assistant that you did not have a good experience with. Think about how you felt and do the opposite. Think about how you maybe felt like, this person didn't care. This is just a job to them. I'm just another number to them, right? And so when you're delivering care, you want to be opposite of that. You want to make your patient feel special. You want them to feel like you care, right? You want to deliver quality patient care. So use those negative experiences, again, like I said, to do the opposite and give your patient a great experience. R&B says, don't forget to wipe your feet. Hit the like. I know that's right. Wipe your feet before you come in. R&B says, hit that like button. Let me highlight this. Listen, y'all, as you coming into the video, hit the like button, not just the react button inside the chat, but the actual video. Thank you, R&B, for that reminder. And then, so some of the administrators, so that's clinical. And again, feel free to chime in the chat, guys. Those are some of the clinical things you'll be doing. On the administrative side, you may be scheduling appointments, okay? You may be answering the phones, verifying insurance, and also maybe handling referrals and prior authorization. So that's something that I do. I work on prior authorizations where we are getting authorization from the insurance company to cover certain medications. Maybe they don't cover otherwise. They need some more information from us, because they want to know, okay, why does this patient need this medication? Same thing for pre-certifications when it comes to certain procedures. You may have to do that as well, where you're calling the insurance company, or maybe they have an online system where you are explaining to the insurance why we need this covered. Okay. Also, you'll be documenting EHR. You may be even working in the EHR department. That's also an administrative duty. And also, of course, communicating with patients, giving certain reiterating, I can't even get the word out, reiterating instructions that the provider has already given to the patient. The provider may have you, in some cases, reiterate those instructions, doing some patient education. And it's going to be, of course, from the provider, because as medical assistants, we can't advise. So yeah, that's some of the clinical and administrative duties that you may do as a medical assistant. And again, I wanted to go over that because I'm just noticing by some of the comments that there are some people that want to get into the field and really not even clear on what a medical assistant does. James said, I just finished my first week of class. After class, my professor told me your patients are going to level. Oh, that's so sweet. That is such a big compliment. Wow. That's good, James. And you have to be lovable. You have to love people. You have to enjoy people. That's one thing I will add to. You have to be a people person. Again, going back to the person that said that their experience with medical assistants had been bad. Just think about think about that person probably don't even like people. You can't be in the medical field taking care of sick people, and you don't even like people. I had a student one time tell me they don't like people. I was like, why are you here? I was serious. I'm like, because she said I don't like people. I'm like, why would you want to be a medical assistant then? Sometimes people just get into the field because somebody told them they had to. They may be young, fresh out of school. Their parents tell them you got to do something. Or sometimes people think they're going to come into this field and make a lot of money, or just multiple reasons why people get into the field that does not involve loving people. And I always say you may want to think about it. If you know you don't like people, you might want to think about it. James said, I was told if you have to do a blood draw for someone with difficult veins, drinking water helps veins. Yeah, it does become more prominent. But what should you do if they have nothing? Oh, this is a really good question. If they have nothing, so if they can't have anything to drink, you can warm the site. So there's other ways. So besides drinking water, you can warm the site. Another thing that helps is if you have the patient squeeze on something, and then of course making sure the tourniquet is tight, and then sometimes even having them put their arms down to their side, right? So there are other ways besides not drinking water, but that's a really good question. So warming the site, making sure the tourniquet is tight enough, right? Having them squeeze on something, not pumping, but having them squeeze on something, and then also having them, they're sitting in a chair, just kind of have them just place their arm down to their side. That sometimes helps as well. Good question, James. Hey, Ms. K, I know where I'm going to go for my externship. It's a primary care office. What should I expect from primary care office? Etc. Okay, so primary care, now age is going to primary care. So it depends on what type of primary care. So primary care can be internal medicine and it can be family practice. If you're going into family practice, you're going to be seeing a little bit of everything. You're going to be seeing babies. You're going to be seeing adults. You're going to be seeing teens, physicals, doing a lot of referrals. Same thing with internal medicine, except internal medicine is usually adults. So you're going to be seeing a lot of different things. You're going to be doing EKG, patient coming in for chest pain, EKG. You may have to do urinalysis of a patient coming in complaining of, issues with urination, frequent urination, of course, itching. They may see blood or whatever. You may, I mentioned referrals, chest pain. You'll be doing EKGs, different things, STD testing, getting urine samples. You may be drawing blood if they don't already have somebody to draw blood. That's a good thing about primary care. You do a little bit of everything. And then referrals, I know I mentioned that already, but you're going to be doing a lot of referrals unless they already have someone to to do those. And the reason why is because primary care is the person who has to refer, depending on the insurance. A lot of patients have insurance where they need referrals. So they're going to always be coming to you when they need to see the cardiologist or a urologist or a nephrologist or whoever. If they need an x-ray or whatever, they always have to come back to primary care. So that's why you'll do a lot of referrals. So it just kind of depends. You may be giving injections, especially if you're in family practice and you see babies, you're going to be doing a lot of injections. And it gets really busy. I've been in family practice and it gets really busy because, like I said, you see everybody. Do you know if it's internal medicine or family practice, Nyasia? Hey, Jessica, I'm good. How are you? You taking your test on the level? Oh, wow, Jessica. Good luck. Jessica's one of my regulars too. That's always around. And she's one of my channel members as well. Shout out to Jessica. How are you feeling about the test, Jessica? Are you nervous? Are you feeling confident? What's your strong areas? What areas are you struggling with? James said, I also finished a couple of scripts of the videos I want to post on my channel. Yes. I shout you. I said, what's the name of your channel, James? I don't think you told me before. Put the name of your channel in the chat and I will subscribe to your channel. And then y'all make sure y'all subscribe to James' channel. James started a channel, a health channel. So make sure you put the name of it in the chat, James. Jessica says, I'm nervous. It's normal. Just make sure, Jessica, that you have the test plan. If you don't already, make sure. I hope you already by now have it downloaded and you've been going over it. BKNY Charlie says, do you think it's best for a brand new MA to start in urgent care? I have an interest, but I'm kind of scared of the fast pace. So I've had students who start in urgent care, and I will say the good thing about starting in urgent care as a new MA is that if you can work in urgent care, you can work anywhere because it's fast paced and because you're doing a little bit of everything. So I wouldn't necessarily say it's best for a brand new MA, but it is great experience. You know, I don't even, to be honest, I don't even, let me see. I don't even really have a specialty that I would say is maybe family practice is probably the only specialty that I would say I'm a literal person if y'all don't know. So certain words just stand out to me. So when you say best, the best that I would say would maybe family practice because you get a taste of everything. But even then, is not the best for everyone because my first specialty was GYN and I love the female anatomy and I learned even more about the female body. So I would say generally the best, I would say maybe family practice, but even then again, like I said, that may not necessarily be best for everyone. I just say that because you get a little bit of everything. But to answer your question, I wouldn't necessarily say it's the best, but it is a great start. I would say it's a great start because it's so fast paced. You do a little bit of everything. You're going to be, you're going to have like emergencies. You're going to be doing, anything as simple as a urinalysis to actually maybe having to wrap a wound, you know what I mean? And assist with maybe even assist with suturing, you know what I mean? It just depends. You can, so many different things. So I would say it's a great start for a new MA if you want that fast-paced environment. Not necessarily best though. And I think you should go for it. I think you should. I know you said you're scared of the fast pace. It could be, but if you are, there are certain things that's transferable, right? So you may be a brand new MA, but you're used to working under pressure, right? So if that's you, you may go over there and be fine. But if you're, let's say you're brand new MA and any other job you've been in, customer service or whatever, you've never been great under pressure, then it may not be for you. So that's one of those transferable skills that just, if you work under pressure, you work under pressure well, you can kind of move around, Oh, now AJ is family medicine. Okay, that makes sense. So yeah, you're going to be seeing babies, teens, adults. You're going to be doing a bunch of everything. Referrals, like I mentioned, eye exams, hearing exams, urine, possibly even some feces. Like you're going to be doing everything. And that's why family medicine, that's one of the reasons why I do say is it's like, if like when I think of which specialty is the best, that's the first one that comes to mind because you do so many different things. And what family medicine and urgent care have in common is the fact that you do so many different things. It's just that, of course, urgent care is fast paced. James said, I'm going to use this. Oh, James. Oh, that's the name. Okay. This is, oh, so it's on this channel. Okay. So guys, make sure you check out, I don't even know, is it Iyer? Is that how you pronounce it, James? So James is doing a health channel. So you guys can check him out over there. And it is on the screen for anybody who maybe wants to screenshot the name of it and check him out over there. And let us know again in the chat, James, what kind of things you want to be talking about on that channel. Oh, I just mentioned this. I literally just answered this question. Cherie said, is there a specialty you recommend for beginners and newbies still in school but trying to get it? I just literally talked about it. For me, I would say family practice, just because you do a little bit of everything. Oh, one thing I didn't mention about it is that the reason why I like that you do a little bit of everything, because it kind of gives you an idea what you want to focus on. So my first specialty was GYN. I love the female anatomy. But then after that, I did go to family practice. And then I got, I was doing EKGs, and then I ended up working in cardiology, so you're doing different things. And then also in the family practice specialty I worked in, one of the doctors I ended up working in, she was also OB. So we ended up seeing OB patients as well. And I was assisting her with certain GYN procedures as well. But then I was getting feces specimens where I had to do fecal occult testing and then urine and all of that, So you kind of do different things. So I would say family practice is that one that if y'all ever want to know where I think you should start, that's the first one that's always going to come to mind. And then you, like I said, you seeing anywhere from babies to adults, and that kind of lets you know if you want to, you might prefer the babies and kids, and you might want to work in pediatrics, or you might prefer the elderly patients, and you might want to work in geriatrics, right? They're asking you the name of it. Okay, Pauline, I just put it on the screen, Pauline, if you're still here. Jessica said, I've been studying. Okay, make sure you have that test plan downloaded, Jessica, if you haven't already. Jessica says, I want to work in neurology. Okay. So neurology, you may be assisting with certain procedures, maybe EEGs, electroencephalograms, maybe. I know you may be doing, one of the things you may do in neurology is assessments, like you may have questionnaire that patients have to do, and if they score, and I don't want to misspeak, I've never worked in neurology, I just know just a little bit from it, just from teaching, but I've never actually worked in it. But I know of some of the things you may assist with in neurology. And depending on what type of procedures they do, you may assist in, I forgot the abbreviation, but basically when they are, what is it? Oh my goodness. What is the procedure called when they're getting the spinal fluid? I forgot what the procedure is called, guys. Please forgive me, but you may have to assist with that as well. It's pronounced Iyer, like Ireland. My full name is James Edward Iyer. Is going to be talking about my cancer journey. Oh, okay. And reacting to medical shows in the same vein as Dr. Mike. Got you. I love it. I'm definitely going to subscribe. So y'all make sure y'all check out James on YouTube, guys. He's going to be sharing his cancer journey. And I'm sorry, James. Wow, I'm sorry. And reacting to medical shows like Dr. Mike. That's awesome. I'm looking forward to seeing it. Ty is watching from Kansas City. Okay, guys. So I just wanted to go live in here just for a few minutes and give you guys some of the duties that medical assistants actually do. Just because, like I said, I noticed that some people were confused about it. They were, mentioning things that CNAs do and actual nurses do. And I just wanted to make sure you guys were clear, especially those of you that are thinking about medical assistant. And I'm actually going to do a whole different video with some things. It's going to be called, it's basically going to be about people that's thinking about becoming a medical assistant and what you need to keep in mind before you go to school. Because I've had students who literally got in school, paid all this money only to realize that it wasn't for them. I had students come into my class, did not even realize that they would be practicing on each other. And I need you guys to know what you are getting into, because many schools, I know my former school, once you go past a certain point, you cannot get your money back. Now, if you come into the first module and you realize, wait a minute, this is not for me, you can withdraw and get your money back. However, after a certain point, depending on the school, you cannot withdraw and get your money back. You can withdraw, but you still owe that money. If you have financial aid and you're on loans, you still got to pay the money back. If you paid the school, you don't get any money back once you get past a certain point. So I want you guys to be sure. Okay. All right, guys, do me a favor again. If you're watching on YouTube, make sure you are subscribed. If you're watching me on Facebook, make sure you're also following me on YouTube, because sometimes I go live on YouTube and not on Facebook, because Facebook deletes the lives after 30 days, whereas YouTube, they stay up. If you haven't already, make sure you subscribe. I'll see you guys. I may go live, I don't know, one day this week. But as you guys have seen, I have been going live a lot more, and I will continue to do so. If you have any questions, you know, you can always leave it in the comment section or email me. Y'all be blessed. Hey guys, some of you have said in the comments, Miss K, how can I thank you? Well, one thing you can do is hit the subscribe button. Many of you are watching the channel, but you are not subscribed. I would love for my subscriber count to match my views on the channel. So if you're not already subscribed, make sure you hit the subscribe button and get back to the video.